everyone, and welcome to this National MS Education and Awareness Month conference hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from Biogen, Genentech, EMD Serono, Sanofi, Viatris, Sandoz, and Bristol Myers Squibb. I'd like, before we begin, to introduce you folks to our this year, 2023's toolkit that we came up with. It's a wonderful way every year that we celebrate and honor the National MS Education and Awareness Month. So we put a lot of effort into it. We want to make sure that everybody gets this. And if you haven't received it, then we want to make sure you have the ability to get it. So if you are receiving, if you're already on the list to receive your Focus magazine, you're going to automatically be getting that. And you should be getting that in the next week or so at the latest. If you don't, and you'd like to be put on the list to get it, you can just simply respond to your email that you got earlier today reminding you of this conference, and we will go ahead and just send it over. Just tell us you want it and we'll put you on the list. So let's see, this toolkit has different activities such as checklists and worksheets that can assist in keeping you grounded, but also finding new ways to prepare you for the upcoming future of MS. There are topics in here to guide you in your personal journey of living with MS, healthcare tips, such as advocating for yourself or the latest updates on FDA-approved treatments, and how to navigate within the MS community. I'd like to thank again our sponsors, who are the reason that we're able to do all of these wonderful things for you. So I am going to start and introduce our speaker. We have Pearl Werfel with us, Ph.D., and she's a clinical psychologist in private practice in San Francisco with expertise in wellness, stress, anxiety, and pain mitigation and multiple sclerosis. She has led groups and workshops for people living with MS for over 20 years. Dr. Werfel is the lead author of Multiple Sclerosis, Advances in Psychotherapy, Evidence-Based Practices, a book for mental health professionals. She was inducted into the National MS Society Volunteer Hall of Fame for Healthcare. She is a member of the NMSS Health Provider Council and is recognized by the National MS Society as a trainer for mental health professionals and a partner in care. Dr. Werfel is also a consultant with Can Do Multiple Sclerosis, and she also has a position with the Multiple Sclerosis Foundation. And so I am going to let her take over right now because I want her to tell you all about her title, MS in Today's World. Oh, I'm sorry, that is our book, forgive me. Forgive me, Dr. Werfel. You are reading Coping Techniques Living One Day at a Time. That's what we're talking about today.
So yes, we are.
And after your presentation, I'll let everybody know that we're going to open it up for questions and answers. If you'd like in between to allow people to ask questions, go for it. You can do that too.
And actually, we are going to be doing that because I have asked people to have something. And hello, I am Dr. Pearl Werfel. I've asked you, or you've gotten information, to have something where you can write something down or note something or even tell somebody if writing is not a possibility for you, so you can have some takeaways and you'll have an opportunity to share some of that in the chat as we go along. So let's go on with coping techniques. And what I need to do, I apologize, I need to make something much smaller so I can see my screen. So we all know that living with MS is difficult. And I cannot tell you that all these coping techniques are going to make MS easy. But we can have acceptance and creativity so it can be easier, less painful, less complicated, even more rewarding to have a life with MS, as many of you know. And what I'm going to be asking you today is to join me with some curiosity and maybe a little bit of humor. So I want to start with just showing you this. This is a picture of something that a person called a balance artist is doing. And what he's doing is he's putting rocks one on top of the other. They're not glued together. He just finds a way to place them so they don't fall over. But if you notice in the picture, it's right by the ocean. So the wind comes, the water comes, and it knocks it back down. And then this person comes and begins to rebuild it. And that's often what happens with living with MS. You figure out your coping strategies, you figure out the way it's going to go, and then something changes and it feels like it all falls apart, but you still have the ability to rebuild. So I wanted to share this picture. So I want to start with asking a question. What is a good day? And what is a bad day when you're living with MS? And invite us to maybe exit that good, bad paradigm and think about things a little bit differently. Because there will be days when you have more energy and less pain and more mobility, and days where you feel like you're just slogging through the mud, where living with MS is just really difficult. And it's about what you do with those days that can have a big difference with your overall experience of living with MS. So what we're going to be talking about, and I'll be repeating this again and again, how we think about things influences our ability to cope. So I love this picture I found. If we have a new mindset, maybe we can have different results or new results. So here we go. I'm saying it again. How we think about something influences how well we will be able to cope. So what do we do with days when moving around is easier, when there's more energy, when there's less pain, when there's more mobility? Well, we can appreciate and use this time to prepare, get some things done, set some things up, do some things to prepare for days where there may be less ability, or we can really take advantage of it and just push through and overdo. And those of you who know about energy budgeting, if you overdo, you're setting yourself up for the next day potentially being very problematic. So it's that balance, and we talk about those rocks going on again, in finding a way to appreciate and prepare without pushing. What do you do with a day that's more challenging? Well, of course, there can be some frustration, some grieving, especially if you had something you really wanted to do with that day. Some people feel like they want to give up, and then they just write the day off. It's a total loss. Or you could utilize that day to rest up, replenish, knowing if you give your body back what your body needs, you can restore. That will give you better opportunities for another day. So here's your opportunity to say, you know what? I'm going to be a princess or a king. I'm going to read a book, watch a special movie, listen to a new piece of music, spending time just laying around, lounging outside, or with a pet, really appreciating and giving yourself some time. Maybe there's some photos from the past that you want to revisit, or an article you've been really looking forward to getting in touch with, but taking advantage of that day so it's not a day of loss, it's a day of rest and restoration to set you up for another day. So if we talk about coping and coping skills, it was discovered through some research, and Schwartz led the research, that effective coping is not one way. There's not one way to cope, but the best way is coping flexibility, which is why I bolded it and underlined it. The ability to recognize when what one is doing is not working and finding a new approach. And sometimes it's done through trial and error. What works, what doesn't work, as you know, often with MS, it's trial and error. Culture influences coping. So your values, your attitudes, your beliefs, your cultures can influence the way you cope, which is why there isn't one way of coping. For example, some cultures tend to utilize more religious coping, might lean more on religious beliefs, whereas other people, other cultures may not. Some, because of maybe the way your culture is or the way you were raised, are relying on more individual methods, like I'm going to do it myself, I'm going to pull myself up by the bootstraps. While others might look towards community or family support when things are rough, say, hey, gather together, I need help, I can't do this alone. So here's a list of different types of coping. We're going to be going over these several different times, so you don't need to remember them right now. But I just wanted to show you that coping can be set up in several different categories to make it easier to kind of understand them. Instrumental, avoidant, meaning focus, benefit finding, and psychological. Now let's get into them. And you're going to see right now there's a big chart. But let's take it one piece at a time. And I promise you later on, you'll have individual slides to break these down. But we're just, introducing and reviewing right now. So avoidant, we all know about avoidant coping. It's distracting ourselves. It's really helpful short term. So if things are frustrating, you can't do it, stopping, listening to something, reading something can be a really great way to cope. However, what are the downsides? If you're spending, and you probably have experienced this, maybe all of us have experienced this, if you're spending too much time with avoidant coping, you're not getting into problem solving, you're not changing the situation, you're just getting away from it. And we look at psychological coping. Psychological coping is exploring those feelings, having that emotion, crying about it, getting frustrated. It can allow, if you get into it, for you to move from being upset to acceptance, to psychological adjustment, especially if you talk about it with someone. But it can also increase your distress or lead to even helplessness if you're staying in the frustration, in the sadness, in the upset. And it certainly doesn't move you into problem solving. So we begin to see that each one of these can have a positive and a not so positive result. And then there's instrumental or problem focused. And this is problem solving, taking action, doing something different. Now, this addresses an issue and can increase your sense of mastery, your sense of agency, self-efficacy. But if you continue to move into trying problem focus, and you're not finding an answer, or you're exhausting yourself trying to find an answer, trying to be problem focused, then it can increase your helplessness, especially if maybe what you need to do is recognize what a hard time you're having and taking some pressure off of yourself. Two more. We look at meaning focused, and that's finding life's lessons. We've all heard making lemonade out of lemons. So that's strengthening relationships, personal and spiritual growth that might come out of when you need to ask for help, or when you seek community, or as a result of having MS, finding more meaning in your life, getting stronger, taking the time. However, again, it can prevent some action, some changes you might need to make if you're always looking at the bright side and finding a way to reframe. You might need to take some action that you're not getting to. And for some people, putting on that good face and trying to find a positive way of looking at it can mean that they're denying how hard a time they're really having. And sometimes acknowledging that you're having a hard time enables you to make some changes. And the last one is benefit finding. This might be prayer or positive reframing. It increases acceptance. So examples of benefit finding are people that are recognizing that MS slowed them down and enabled them to do something else, that some people find that there's some benefit in self-care. And this is really helpful, again, if you're always going and saying, okay, this will bring me closer to spirituality, or this brings me closer to someone else, and you're looking at the benefit finding, it can prevent action. So I've left you with sometimes it works and sometimes it doesn't work. And that's where we get to go in and do our work. So here's a question. How do you know if it's helpful? Now that I've let you know that each of these different types of coping can be helpful or not so helpful. Well, if you do something and you feel better afterwards, that's probably helpful. Does it change your perspective? Has it made your life just a little bit easier? Then you'll know that your way of coping is actually working for you. Or do you feel about the same or even worse? Do you feel stuck or more anxious? And does it feel like you need more and more? And especially this is avoidant. Does it feel like, oh, I need to watch one more thing, I need to read some more, and it doesn't help restore you, it just keeps you in the place of avoidance. So looking for you to look at, is it helpful, is it not helpful? And we'll have an opportunity to do that in just a moment. So what I'm going to ask you to do in a minute is take some time to think about each of these coping styles. Don't be worried about it right now. I'm going to review each one of them and think about if you've tried it. Are you overutilizing it or are you using it? Are you using it too much? Is some not effective? Some of the ways you've been coping really not effective for you? And is there one new way of coping that you'd like to try, that you've thought about that you'd like to try? So I'm going to be asking you this in a minute, and then I'm going to be inviting you to put some of this into the chat, because what we talked about in advertising this program is coming up with some individualized skills just for you. So here we go. We're looking at avoidant. This is when it's working for you, it's restorative. It's restorative distraction. It means that after doing it, you feel less stressed. You feel a little bit better. And you're ready to look at doing something. It could be listening to an audiobook, just an example. Going outside and seeing the flowers. This person here is gardening, playing with a pet. There's many different ways of avoidant coping, getting away from it for a minute. So this is a time that I'd like you to take a couple of minutes and think about the way you do avoidant coping and if it works for you. What's your favorite go-to? And then I want you to think about something you haven't done that might be nice, that you'd like to try. And what I'd like you to do is note it for yourself, because I want you to have tools to take with you. So note it for yourself. What is something that works for you? in avoidant coping? And what is something you would like to try? Take a moment to think about this, note it for yourself, and then let's have you put it in the chat, any of you that are willing to share. And then we'll have Deb give us a couple of examples of what you came up with avoidant coping. And we'll just take a couple of minutes.
Dr. Werfel, I don't want to interrupt people while they're doing that, but I do have a couple questions that came in through email that the person wanted to make sure. I don't know if they weren't able to put it into the chat, but they had come in, so I want to make sure that we ask that. You let me know when that would be the appropriate time to ask.
Sure. Are you talking about general questions?
General, not related to right now.
Okay, so do we want to just maybe hold those till the end, the general questions?
I can.
Let's just do that, and let's just hear what people may have had to say about an avoided coping that maybe is their favorite go-to that they can share with people, or something new they'd like to try. Are we getting any responses?
We do. Antoinette said that she currently goes outside and she must takes in nature. But
Wonderful.
Let's see, I currently go outside and take in nature, but I'll try listening to an audiobook.
Excellent.
Yeah, nice. Let's see. Then we have this chat shows disabled. Let's see. Marathoning, my favorite comedy shows.
Oh, yes.
Taking a walk in nature. Yeah. That's what
we
Casey
have a walk in nature, and we also have that term I'm hearing someone uses binge watching, and that helps sometimes. Yes.
Oh yeah. Oh,
anything else?
Let's see. Sherry says her chat is disabled also. Casey, can you see about helping these people? I don't know why
I'm looking to see why that would be, and I'm not finding it. Bear with me.
Yeah. Okay, well, we are fixing that. We can see if there is anybody else, or then we can move on to the next ones. Anything else to share?
Actually, several people want to do this, and another person just said that it's disabled for them too. So I wonder if these people, maybe you can just raise your hand and I can call on you and you can ask the question, or at least tell me your view or your
or Deb, you know what?
Found it and fixed it.
Okay, fixed it.
It should work now.
Okay, so now I'm going to go on to the next one. So those of you that didn't have the opportunity to share last time, please share with the next one and we'll get your new ideas, okay?
Okay, cool. Oh,
this
wait.
Is what, yes?
Sorry, but something came in Bible study at a local church with other ladies. So I wanted to make sure.
Okay. Excellent. And Bible study is actually going into meaning focus. It's not so avoidant, but thank you for sharing that because it's a great coping skill. So let's go on. We'll have a chance to mention that as we go along. Psychological. So this one, remember, is getting in touch with struggles, difficulties. But the way to turn it into coping might be writing in a journal or talking with a friend or family member or seeking help from a psychotherapist or joining a support group. So we're asking you now, what do you do to honor or respect when you're struggling, when you're just having a hard time, when it's feeling bad? I want you to note for yourself what's helpful for you, because I'd like you to take away kind of a little cheat sheet of different ways of coping. So note it for yourself and then please share it in the chat.
And Dr. Werfel, while people are thinking of those things and putting them down, would you like me to read out the ones that came in from the last one?
I think if we have time at the end, we can tap into those, but I just give people a chance to just think about this next one, because this is a harder one to think about. Avoidant is the easiest one. This one's one of the more difficult ones. What do you do just to honor your difficult feelings? What are people saying?
It's going to be a bit difficult for me to determine which ones are
Sure.
coming in right now and which ones are coming in from previously.
Absolutely. So if you can just look at some of the content and just see if people are saying anything about, what they do with their when they're having a really hard time with their hard feelings.
Somebody's praying to God.
Mm-hmm.
Maisel said she prays to God, and Arnita said I listen to jazz.
Mm-hmm.
Gospel music. Journaling is helpful.
Mm-hmm.
Let's see. Journaling is helpful. Support groups make it worse. That's coming from Diane.
So some people don't find support groups helpful. That's important to know. We're asking you to evaluate what works for you.
And Natalie,
you may want to try a different support group if it's available to you, but go on.
Natalie says that meditation, anxiety journal, talking with friends works.
Excellent. So that's really good. An anxiety journal, meditation, talking with friends, really good. All really good ideas. You are all welcome to take some of the ideas from other people, and if you like them, record it for yourself. That's why we're sharing them.
Great idea.
So I'm going to go on.
Sorry. Do you want me to keep going?
I was going to go on to the next one. And then what I'm going to say is if we have time, then we can go back to some of the ones we may have missed, if that can work.
It can work any way you'd like it to work.
Okay, so let's go on to, folks, we're trying an experiment. We're trying to make this interactive and like we were all together. It may have some glitches, but we're working on it. Okay, this is instrumental problem focused. This type of coping is doing something about it. So here's the picture of someone in physical therapy. It might mean going out and getting exercise. So I'm having a hard time, and what do I do about it? I might go and get myself some exercise, because that might help me change my mood and also improve my health. Consulting with the physical therapist, it's getting harder and harder for me to do some things. Instrumental means I'm going to get someone to help me with this. The other thing, if you're struggling more and more, is organizing an idea. This is a problem-focused thing. Organizing to make things more accessible. So if you're struggling with a skill like cooking, how can I change things in my kitchen to make it easier for me? So this is direct actions that solve, that address the problem. So I want you to think about things that you have done that are direct actions that actually change, or maybe not completely solve the problem, but make it a little bit more make you more able to do something. Sorry, I was tripping over those words. And please think about it for yourself. These are action items. Note them down for yourself, and then let's share them in the chat. When you've had some difficulty, you've actually looked at it as a problem, came up with some problem solving, and then coped by doing something. Are we getting anything in the chat about this?
Yeah. Margie
Excellent.
said, get a light therapy light, boosts mood and energy.
Excellent.
Joy said, yoga helps as I'm doing. Struggle, let's see, yoga helps as I'm doing. Struggle, I don't practice. Oh, struggle if she doesn't practice for a couple days. Jen says that house walk as I'm limited to go outside. Diane says, this is my go-to. Home exercise room, stretch lab session, massages, chair yoga. Anita said, put everything together. Vanessa says that she does physical therapy a couple times a month.
So these are all really good. And those of you who haven't thought of some of these, please take an opportunity to note these down. I also like that someone noticed when they don't do something that they notice the difference. That's how you know it's working for you. Or if your go-to is exercise, and you're more fatigued afterwards, then you look at, okay, maybe that was too much. So another way of coping, these are all ways of coping, making it work for you. I'm going to move on to the next one. This one is the way of thinking about things. It's meaning focus. So we've all heard when life gives you lemons, make lemonade. I found this picture. I love this. When life gives you lemons, get creative. So this is a way of kind of making meaning out of what's going on. So that could be if you have experience in living with MS, sharing your experience with someone that's newly diagnosed, especially some of the ways that you've made it more doable, is a way of making meaning, because what my struggle can now help somebody else. We've talked about this, using a low energy day to say, whoa, I've been meaning to get to those photos and to look at them, or maybe, rearrange them in a different way. So you find a way to make meaning out of what's going on. And the other thing is finding your unique contribution. If because of MS and disability, there's certain things that you used to be able to do that you can't do anymore, there's a grieving that comes with not being able to do it, and that's the psychological coping. But then if you look and say, what can I do? What is my unique contribution? I am always aware of all kinds of jokes. I can send those out. So this is making meaning of what's going on in your life, and another way of coping. And let's see what people have to say about this. Make a note for yourself, and then let's share.
No, Nora said, help other MS patient friends with advice and asking advice as well.
I want to comment on this for a minute. I love this. You've just combined two. If you're sharing with someone some advice, that's making meaning of your experience. But if you're getting advice from them, now we're going into a different type of coping, which is that psychological coping. You're getting help too. I love it when a type of coping can do both. Wonderful.
Let's see. Be active on an MS Facebook group. That's nice. Yeah, there's some really wonderful MS Facebook groups. The support groups on them are wonderful. Let's see. Margie says, see Kenzig MS for free dinners, live events sponsored by MS drug companies. Meet others coping with MS there.
So I'm hearing that there's kind of a, okay, I have MS, but I can get a free dinner out of it. That's great coping. I love that.
Socialization, right?
And socialization, of course, but I love it. We need to have a sense of humor about this. Yes, that's great. What a great idea. And I love that you found that. That's wonderful.
Antoinette agrees. She likes the MS events. She says those are the best. Yeah.
Okay, so let's go on to the last one, and then we'll have see where we are in timing, and if we have some time to pick up some of the ones we've missed. This is the last one, and this is finding meaning. And this is what's called benefit finding, which is a positive reframing. So this is an opportunity for you to ask yourself if there are any positive changes in your life that have come from learning to live with MS that you wouldn't have gotten. And I can give you some examples. I happen to have a client who has a history, a pretty large history of heart problems in his family. And he was acutely aware of if he hadn't gotten MS and learned to slow down, he probably would have had the same issues as his family members, and men in his family died young. So he, in that way, felt like, I don't want MS, but maybe I can make some meaning out of it by saying, hey, maybe this extended my life. So this isn't about, oh, I'm so glad I have MS. It's about finding meaning. And this is, or benefit. Some people feel like it made them a more compassionate person because they understand people's struggles now. And some people feel like, oh, I was so focused on doing that I didn't have a chance to build relationships. And now I take more time to build relationships because I had to slow down. Those are just some examples. This is one of the hardest ones. And some people feel like they haven't found any benefit, and that's okay also. But if there's changes that you've made because you live with MS that have actually benefited your life, note that. Now, I've heard people say, so great, I have learned so much, now the MS could go away. Thank you very much, I've learned that lesson. And that I completely understand. But just to ask, and if there's nothing that comes up, that's okay too, because this is one of the hardest ones. But let's see, Deb, anything coming through?
Let's see. We have, well, let me just do this first because there might be people here today that are new to Zoom and aren't familiar with how to put their questions in. So if you have a comment or a question, all you have to do is go to the bottom of your screen and you go to the Q&A area or the chat area and you can type in your question. And let's see if that makes any difference. For that, you can even make those anonymous if you like. We don't have to read your name. Okay, let's see. Taking time to smell the flowers. I like that, Arnita. That was nice. Let's see. Dolores said that she's learned to appreciate the good days, even as something as simple as being able to take a deep breath.
Mm-hmm. Wonderful.
Casey said Felicia on Facebook says it has definitely made her more empathetic.
So glad to hear that.
Ms. Coleman said she joined a prayer group. Yeah. And Nahora said, my lifestyle changed to healthy cooking and more physical movement, added meditation and mindfulness, learned more about my body structure. Let's see. I quit my farm job and returned to making art full time, Anna says.
Wonderful.
Antoinette said that being grateful and learning of mindfulness has helped her. And
really wonderful.
Yeah. Vicky says more empathy for others. Natalie says, I worked at SLP at home care. So it really, whoops, I just lost it. We just lost this. Let's see. I work at SLP at home care, so is really good, the empathy and compassion for the patients as an MS patient. I guess when she sees that and she's able to help. Jacqueline said, I decide to join an MS support group and share my time and abilities to talk in public.
I am so impressed with this group because this one is the most difficult one to say, yes, I have MS. It has so many struggles, and I'm with you. I have MS also. So I'm with you on this one. But one of the things that I got out of living with MS is I get to help other people with MS like I'm doing right now.
Right.
And so that's, if I hadn't experienced living with MS, I wouldn't be able to actually understand what people are going through, or with other chronic illness. So I'm really impressed that people were able to come up with these.
Good point. I do have a couple more. Do you mind?
Actually, what I was going to tell you is this is the end of all of our different ones. So we have time. I love it. I'm rarely ahead of time, but we are. So let's
Okay.
hear, because I'd love to have you learn from each other. So share, absolutely.
Diane says that she became more of an activist for people with disabilities. Erica said she met and saved 3 rescue dogs as MS made
Oh,
me move, change path. So I was um, here for them. That is now 100% to MS.
that is wonderful.
Dude.
You saved some lives. Thank you for that.
And Vanessa said she feels like it's made her a stronger person. She feels that she can beat anything, even though this is really hard.
Yes. That's wonderful. Thank you. So,
Nicole says, oh, I'm sorry. Go
no,
ahead.
what I was going to say, Deb, is because we had some problems with the chat, I'm going to welcome you to go back and read any of them that may not have to do with benefit finding, but just in general.
Okay. So, in terms of benefit finding, Nicole said, definitely have become more compassionate to myself and others. And Erica said, I discovered a superpower, MS, adaptable.
Oh, whoa. Thank you.
Yeah.
That is so important. If you can adapt to living with MS, you are a powerful person. It is a superpower. Absolutely.
Yep. Maisel said she's become more empowered, and now she's going to an MS walk. Oh, let's see. Tabitha said, I am a nurse and I am able to understand others. It helps that she has peripheral neuropathy because she knows how it feels like, what it feels like, and how uncomfortable it is to have cold feet and numbness and tingling. So,
That compassion, you know it, you understand it. You didn't just read it in a book or learn it in a classroom. You understand it, which enables you to help someone else and say, I understand.
yeah. Arnita said, I have MS and it doesn't have me.
Yes.
There you go.
Yes.
Okay, so Aaron said that his distraction is watching an enemy and Janie's, oh, watching enemy,
Anime.
anime,
Anime, anime.
anime. Okay, I guess I haven't watched anime.
That is very creative. Yes.
Let's see. I just lost it. Let's see. Anime and Janie said her psychological coping is a good cry.
So important. So important. Yes, some people are afraid to get in touch with their feelings and cry. And sometimes we need to cry. We just need to cry. If it doesn't stop, then we get some help from someone else. But sometimes we need to cry, or we just need to scream sometimes.
Yeah.
It depends. It depends on your culture. But sometimes people just need to scream. And I've heard people do it. I hate MS. Sometimes that can help.
Joy said, as my available quality time declined, forced to winnow the activities and people I spend time with on, don't miss what or who are gone. the overall quality of engagement is better than before.
Yes. You know, that's so important that some people give themselves permission to not engage with people that were causing them stress or trouble. I don't have energy, so I'm going to choose who I spend time with. Excellent. And make it deeper.
Nicole says distraction, petting my cat Mia.
Yes.
And then Ms. Coleman said my distraction is playing games daily. So Margie also said
Wonderful.
Christina Applegate has FUMS on her cane.
Getting in touch with their feelings. Absolutely. Excellent.
Let's go back to the top. Let's see if there's any that we didn't do. Let's see. We did the Bible study, support groups, workout. Nora said, write down emotions to talk to therapist at the next appointment.
Oh, that is so important. Thank you for that. If you're struggling and you note it, then you can come in and say, this is what happened, which can make your therapy appointment much more useful to you and to help your therapist understand what you're going through. Wonderful. It also bookmarks it saying, I note it. That's okay. I'm going to take care of it. And then I can focus on something else. So really good. Thank you.
Yep. Antoinette likes to go walking. And Sherry said, I take some online art classes put on by a couple of MS sites. In fact, the Multiple Sclerosis Foundation that you're with today does have our own art class also with Hannah, which is great.
Oh, that's wonderful. So there we go. A coping skill that's available to people. And I'm assuming that people that aren't that artistically inclined can also participate.
Absolutely. It's fabulous.
Yes.
Yeah. Fabulous for people with all different levels of disability too. So if you're interested in any of those art classes, by the way, you can easily just respond to your reminder email again, telling us that you are, and we'll make sure to get you the information. We'll get it back to you.
Wonderful.
Let's see. Talking to people, Joy says, different people, depending on if it's a physical versus emotional issue. Meditation again.
I like that. I wanted to comment on that. That's really important, knowing who to talk to. Sometimes you need to talk to that friend that has that great sense of humor because you just need to have a laugh. And sometimes you need to talk to that friend that really listens and supports. Really good point.
Let's see. Felicia says that she tries to accomplish something every day in her home, etc., no matter how big or small, and she reads more each day to find out new information on their disease. Yeah.
I really like that. I like the idea, no matter how big or small. Sometimes when you're overwhelmed by a big task, either because you don't have energy or because it's really stressful, doing something else, even if it's small, will give you that sense of accomplishment. And so you might then be able to tackle something a little bigger. Really good.
Yeah. Nora said that she found she can talk to other MS people upon meeting them and have a genuine connection to discuss any MS related topic.
Way to connect with people. I'm so loving all of these. So I am going to now take us to another piece, which is this. I'm going to open it up now and to questions. And also, if people have been listening to this and saying it's really nice, but I don't know how to. If you're feeling a little stuck with it, then we have so many ideas. Maybe we can get some ideas from people about how to unstick you. Deb, do we want to take, do I want to stop sharing now and move it into something else for the questions?
If you're all done, we can keep going any way you like. I do have that one question from that person that wrote in. So I want to make sure before we end that I do that. But I don't have any new questions that came in or comments, although I'm happy. Whoops, here we go. That's all I
Okay,
had.
so I'm going
Yeah.
to stop screen sharing, and now we're going to go into general questions, comments. I'm opening it up. Anything that you may have missed when we were going along that you want clarification for, anything else you want to add to, and there we go.
Okay, good. So Terry says having MS has helped her work more on what she loves doing, I guess, which is barbecuing. She loves barbecuing. Nice. Okay. This question came in. It's sort of two questions, but maybe one relates to the other. And this was an anonymous person. Is there available research on very late onset MS? I do keep an eye on PubMed. Last year at 67 years of age, I was diagnosed with MS based on MRI findings. And then the next portion of her question was, I feel that stress played a major role in my case. My mobility and transient speech symptoms appeared at a point in time when I was beginning to deal with the most stressful of life's events. Are there studies on the role of grief and MS?
Okay, I can answer some of this. Others, I think it would be more appropriate to look at people that are doing the research. So Deb, you might have some resources for this. I know the National MS Society has quite a bit of information on different onsets. So I don't know if you have any recommendations. I can definitely speak to the stress piece.
Good.
If you have, do you have any other resources as far as?
Casey, honest to goodness, I'd love to bring you in on this just to see. I know you know every single thing that we've ever created in terms of publications and information. Do we have anything that can help this person or anybody that's listening?
On the role of stress in MS?
No, I can speak to stress and MS,
This is more
specifically about late onset MS, the research on late onset MS.
Yeah.
Not that I'm aware of, but I'm happy to look into it and respond to the person directly.
Awesome.
Okay. And I would also suggest going to the National MS Society website because there's usually quite a bit of information there. Yes, there definitely is interaction between stress and MS. I actually did another webinar on stress and MS. And stress doesn't cause MS, but stress can increase it. So there are many different theories about MS, but one of the ones that are being looked at now is it's kind of there, latent in your body, and it shows up. And it's going to show up when there's more inflammation. As we all know, anytime we're under stress, any owies in our body act up because of inflammation. Our balance can be off. We can get headaches. We can get stomach problems. This all happens with stress. So this is going to bring up MS. So there is that stress component. Initially, when people are going through a major issue, there's something that's protective. Our bodies protect us to allow us to go through the crisis. And then we see the physical problems later on. So anyone living with MS knows that if they go through a stressful time, they're probably going to have more fatigue later or more difficulty. Grieving is a form of stress. So yes. So sometimes if people have had a lot of stress and a lot of grief, their MS may present pretty dramatically. And as they get more help and more stress reduction, they may find sometimes that their symptoms aren't as difficult. So that is to be evaluated with a neurologist and probably a psychologist to see what kind of skills that you can get to deal with that stress. And if it's in a trauma, if you've been through trauma, there are people called trauma-informed therapists, and they will help you work through the trauma that's held in the body. We all hold trauma in the body. To let go of it so that living with MS can be a little bit easier for you. So I hope that answered the question.
Great answer, Dr. Werfel. That was wonderful. Okay, so Erica, hi Erica. She has a question, or actually a comment. She makes herself say aloud 4 things, I guess, every day, and all positive. And at the end of the day, it helps her mind calm down. Does 4 things aloud.
That is, so they're like affirmations. That's wonderful. And I love that you're speaking it aloud. When we say something out loud, we take it in through thinking it and also through our ears. So the message comes to us twice. Excellent.
Interesting. That's all I have. Let's see if anybody has any more comments or any questions for Dr. Werfel. I just lost you,
We have
Dr.
we have about 5 more minutes, so we have time for questions, comments. Anything anybody might want to add?
There is a hand raised, Deb.
Actually, I don't see that on my screen, but let me look.
Okay, I can activate it. It's Carrie Ann.
Hi, Carrie. If you could, that would be great.
Carrie Ann, you can feel free to unmute. Okay, I'm guessing that we have lost Carrie Ann.
There she is. Hi, Carrie.
I'm sorry. It must have came on when I went into the store. I'm real sorry.
It's
no problem.
Do you have a question, or would you like me to? Nope, you don't have a question. Okay. Tabitha just wanted to say thank you to you. She thought your information was very helpful. Nora says
I'm sorry. I'm just listening. I'm newly diagnosed. I've had it for a long time, but they've just diagnosed me. I've been listening, and most of what I have seen is negative. So, and I'm just listening because I'm one of those persons that cannot afford to pour negativity into my system because I've got 2 young kids. So I'm just trying to deal with the disease and trying to stay positive so I can live as long as I can to make sure that they pass an age where they can take care of themselves. So I'm just listening in.
So Carrie, I think that if you didn't have an opportunity because you were in the store to listen again to this, because there was a lot of positive information that came through, because I agree with you. Those of us in this world, and especially those of us living with MS, can't afford to pour negative into our body. So I'm hoping that you'll take the opportunity, if you haven't, to listen again and get some of those ideas. Thank you.
And Nora said that her mental health therapist will be ending her sessions in June, and she wants to continue this. She thinks she's actually, there's a question mark there, so I think she's asking, should she continue? She wants to speak at least once a month. So that's.
So I think if you have the answer there, if you believe it's helpful for you, then it makes sense for you to continue and to find out why it's ending, if it's insurance-based or if there's some other reason that it might be ending.
Margie said listening to Dr. Barry Singer on Spotify discuss MS with other MS doctors, new research and coping. So that's interesting. Qigong with Jeffrey Chand on YouTube is very calming for mindfulness.
Qigong is amazing. Qigong also can really help with balance.
Let's see. Thank you, thank you, thank you. Anita says, sometimes I forget about the power of prayer, chanting, and yoga. Then I remember, better to hope than despair. Chanting fills my monkey mind with positive love thought.
I love that. If your mind is spitting out stuff that isn't good for you to hear, chanting will fill it up wonderful with something that is healing. Excellent.
Yes. And Nora, thank you for mentioning that. People are responding, thank you. And Nora actually said that she loved this type of format, the interactive part. So I'm hoping that we can do this again in the future, because I also like this. And I think, many of the attendees are of the same mindset, that it's really helpful for them to be able to interact this way rather than just listen, right?
I am really glad to hear that this was an experiment. We thought we'd try it, and it sounds like it was helpful for people. I'm really glad to hear that.
Yeah. And Vicky, I know you're asking, Vicky said that she missed the name of the MS doctor. Was that a podcast? Learning from, let me think, go back. Oh, there were quite a few mentioned. Uh, let's see, there was a Dr. Jeffrey Chand on YouTube. I don't know if that's the one. There was a Barry Singer on Spotify. Maybe
I
that's
think
the one.
Barry Singer was the doctor. I think Jeffrey Chan was the Qigong person.
Mm-hmm. Oh, Dr. Barry Singer. Thanks, Casey. Oh, very informative. Very nice. I don't think we have any new questions. Everybody's just so grateful that this was so helpful. So that was
And
really
we are also, I believe, at time. How convenient.
we are.
Wow.
So let me say goodbye. Okay. So that brings us to the end
Can
of
I
our
first thank you everybody for giving me the opportunity to be with you. I always learn from this, so thank you so much, and thank you for your participation.
Wonderful. We can't thank you enough. So that brings us to the end of our time, everyone. And if you've missed any part of this conference, the really great part is that it has been recorded, and it's going to be available for you for almost an eternity on our YouTube channel and our MS Focus Facebook. So you can reply to your registration email for information on how to access recordings, or to sign up for our newsletter to learn about more upcoming events. Our next teleconference is this coming Tuesday, March 28th at 3:45 p.m. Eastern Time. Our panelists that day are from the Food and Drug Administration and the Association of Accessible Medicines. The topic they're going to be discussing is biosimilar therapies and what you need to know about them. Should be really, really interesting. And there's, I think, 3 panelists that day. So should be very interesting. Once again, I'd like to thank our sponsors, Biogen, Genentech, EMD Serono, Sanofi, Viatris, Sandoz, and Bristol Myers Squibb for their support of this program. Our sincere thanks to all of our attendees for your participation, and especially to our panel, to Dr. Werfel for the time that you spent putting this together, and we're always so thrilled to have you as our guest. And so for anybody that's not familiar with how this works, when you leave, you're going to receive an email asking you to do a survey. That survey is so important to us because we really want to give you the most meaningful content in all of the programs that we provide. And without you telling us if you enjoyed it, if it helped you, we guess. So for you to be able to just do that, I think it's a minute long, if not less, or maybe a tiny bit more. It really does help us, and we'll be able to provide you with the most meaningful things, which is, I'm sure, the reason you're here. So anyway, thank you so much. And Dr. Werfel, we look forward to doing this again with you. Thank you, everyone, and we hope to see you on 28th. I think you'll like it. Have a great night, everyone. We'll see you again. Toodaloo.